Thousands of Filipinos succumb to cancer every year, making it one of the leading causes of deaths in the Philippines. That's according to the Department of Health. But did you know that there is an alternative treatment called cryosurgery, which is offered to patients suffering from different kinds of cancer? To tell us more about this and cancer in general, we have in the studio Dr. Li Qinyu, president of the FUDA Cancer Hospital in Guangzhou, China, and Francis Edward Puno, the country's FUDA representative. Good morning, gentlemen.
Good morning.
Good morning.
Thank you so much for joining us on Daybreak.
We're happy to be here.
Now, this is a very serious topic, cancer, because I mean, it's not one that was just a sickness back in the day. I mean, it's prevalent. It's timeless, so to speak. Let's talk about cryosurgery. It sounds very highly technical. What is cryosurgery about?
Cryosurgery is a new technique to anti-cancer. It's not surgery. It's just freezing the tumor.
Oh, okay.
With a needle inside the tumor, freezing the tumor, destroy the tumor.
Ergo the name cryo.
Yes.
Yeah.
So there's no open surgery.
It's not invasive in that sense.
Not at all. So what happens is micro needles are inserted through the skin and directly to the tumor of a specific organ.
Okay.
The procedure takes about 45 minutes to an hour.
Oh, okay. Well, that's quick. That's not too long.
And what's really amazing is the recovery of the patient, because right after the procedure, Professor New wakes up the patient.
Just like that.
Yes, some patients we can talk when we do cryosurgery.
Really?
Yes.
And then you can tell them what you're doing at the moment?
Yes.
Oh my goodness, that is
Yes.
interesting. So if you were to perform it on me, for example, I could be awake while you're doing this, and but I would be sedate. Would I feel this, or how does
Yes, you will be, you will
Does
be
it
sedated.
hurt?
No, not sedated, but through anesthesia, so you won't feel anything.
Of course, people are going to want to know, there are different kinds of cancer. Now, is there a specific kind of cancer that the cryosurgery is only effective for, or is it applicable to all?
Yes. Any cancer can do surgery, can do cryosurgery, if it is a solid tumor.
A solid tumor?
Yes, such as lung cancer, such as liver cancer, prostate cancer, kidney cancer, pancreas cancer.
Breast cancer?
Yes.
Okay.
There's no need for a
mastectomy.
Wow. It's a wonder surgery, because
it's just blowing my mind right now.
Yeah.
Okay. So for candidates who cannot undergo surgery for whatever reason, like maybe their heart is too weak, so this would be perfect for them.
Yes.
Let's talk about how it actually works. Like, I mean, I understand you were saying, you take a microneedle, you insert that into the tumor. How does it work, necessarily speaking? Like, does it break down the mutated cells? How does it work? So you freeze the tumor,
yeah,
right?
well, for cryosurgery, it's like any living organism. If you freeze it, it will die.
Yeah.
So that's a basic principle.
And then is that 100%? I mean, what's the percentage of recovery from this?
Not treatment 100%, but compared with surgery, some kind of the cancer, the result is the same, such as the prostate cancer and the kidney cancer in the early stage. You can freeze the tumor, destroy the tumor completely, kill the cancer.
Wow, okay.
So that's why in the US NCCN guideline for the cryosurgery become the first choice for the kidney cancer and the breast cancer.
Forerunner now,
But for some other cancers, such as lung cancer and the liver cancer and the pancreatic cancer, the result not come out to show is better than surgery. So for this kind of cancer, surgery maybe is the first choice. But for the patient is too weak, cannot do the surgery, this is
the number one, the first option.
Yes.
Sometimes you hear of cases where, the cancer has been contained, you're okay, we've taken it out, and then just a few weeks later, you come back to the doctor and they say, oh, it's metastasized to your lungs. Like, is there a way that cryosurgery can prevent that from happening?
They have another product called immunotherapy.
Immunotherapy.
Yes. And immunotherapy, it's a product by which they get blood from the tumor or from your blood stream, and they culture the blood and turn that into a anti-cancer vaccine.
That's amazing.
So first I want to tell audience what is cancer.
Yes. How do people get cancer?
If you know cancer, you will know why doctor with this treatment, with that treatment, what's the purpose.
Yeah.
Cancer is the abnormal growth of your body cell. Like your ear, growth to this side stop. If it is a continued growth, bigger,
That's a problem.
Yes, the cancer.
You hear everything.
Yes. If the tumor not only grows, it also spread out to your other part of the body. Metastasis. So cancer cell have two characteristics.
Okay.
One is growth out of control. Another is metastasis.
Yeah.
So treatment for local with surgery, with radiation, with cryosurgery, with local control. The system treatment, we need immunotherapy to prevent the metastasis. Immunotherapy has a long history.
Okay.
By now, it has a breakthrough in many aspects, such as the melanoma, such as the breast cancer. Immunotherapy becomes the standard treatment already.
Okay.
So for other cancer, also more evidence to show its effect.
Right.
So you know why I'm not cancer patient. Why the cancer patient suffer from disease? One of the more important things is the immune system is weak.
Yeah.
We must improve the cancer patient's immune system.
We have patients here who have gone through immunotherapy and they're alive and well.
That's good. That's good
news.
news.
The cancers have not
come back. Right.
returned.
For example, even if a candidate was clear for surgery, invasive surgery, but they said, no, I want to go after cryosurgery, is that an option, a viable option for them? Would you say, okay, sure? Or do you have certain requirements for someone who can undergo cryosurgery?
Yes, we should. Any treatment, we have a standard. You're suitable for this treatment or not.
Okay.
What are the advantage and disadvantage? We will talk everything.
On a case-to-case basis.
Yes.
Okay. Let's talk about traditional methods that people have used all those years prior to cryosurgery. Now, in treatment of cancer, what were the methods like before and compared to this one?
For more than 100 years now, traditional methods have been surgery, chemotherapy, and radiation. And if you look at the statistics, it's a very low success rate.
For all of those?
For any type of cancer. Okay, so there has been through the years an active effort to look for new options.
Yeah.
And up to now, we're still looking for new options. And that's the reason why cryosurgery, we came across that, as well as other treatments which the hospital offers. By the way, FUDA Cancer Hospital, they believe in combining treatments. So, for instance, the cryosurgery is combined with what they call interventional therapy, which is local chemotherapy.
Okay.
The chemotherapy goes directly to the tumor.
Now tell us more about the FUDA Cancer Hospital. Let's say some patients, they want to go and check it out. How do they, or for more information, how do they reach you guys?
FUDA Cancer Hospital is located in Guangzhou, China. That's 2 hours by flight, direct flight. There are 3 airlines that go there daily. Professor New will welcome all the patients there.
Personal touches.
Yeah, and locally, we have a Philippine office in Linden Suites Hotel.
Over here.
Yes, you can contact us through 809-4453. You can find us in Facebook, FUDA Cancer Hospital International. And there's a local doctor here, Hillary, who can do initial screening. And what she does, she does the diagnosis and the recommended treatment plan.
Okay.
But once this is done, this is sent to Professor New, and he has a team of 100 doctors in the hospital. And what they do is they go through the patient's case, and so that they can come up with a personalized treatment.
Oh, that's right. So you customize it. It's not like a general one size fits all. That's perfect. And also the local doctor we have here can help book appointments and help expedite the procedure, so to speak.
By the way, Hillary, FUDA Cancer Hospital, they are the world leader in the most cryosurgery procedures in the world.
Okay.
And Professor New is the #1 guy there.
This is very interesting, and it's good to know that even if it is in Guangzhou, that there is a way for patients here to access this kind of cancer care or treatment.
Yes.
Well, thank you so much for sharing all this information with us. It's a lot to take on a morning, but it's good to know that there are breakthroughs in medical treatments, especially for sicknesses like cancer. Thank you so much for your time and for being here, gentlemen. I enjoyed our conversation. That was Dr. Lee Jinyu, president of the FUDA Cancer Hospital in Guangzhou, China, and of course, Francis Edward Puno, the country's FUDA representative.